Hi, I'm Emma. I'm your student nurse today. My pronouns are she, her. I just wanted, before we get started, to confirm your preferred name and pronoun.
It's Grace and she, her.
Alright, perfect. So today we're going to be doing a basic head-to-toe assessment. That's just going to include me observing you, touching you where necessary, and I might ask you to do some movements for me, just so I can assess that area or the muscle strength. If you have any questions throughout the interview, just let me know. If you're uncomfortable or tired, just need a break, then definitely let me know. Then I would scan the environment for any hazards or any additional cues. I don't see any here in this case, so that's good. And then I would perform hand hygiene before I get started. And I would put my gloves on. Okay, so first for physical appearance, I see that Grace appears her stated age and that she is alert and oriented to person, place, distribution, and time. So for Grace's body structure, her height looks to be appropriate for her stated age, and her body parts seem to be symmetrical and proportionate. So when I was assessing Grace when she was walking in the room, I didn't see any limitations with mobility or anything, and your movements were smooth and coordinated as you sat down and were walking in, and your gait was good. Okay, so for behavior, Grace's facial expression seems to be accurate with what she's told me so far, and your word choice is good, and your language is appropriate. Okay, Grace, so I'm just going to have you sit on the edge of the bed. Perfect. And I'm just going to take some vitals now. So I'm going to take your temperature, I'm going to take your respiratory rate, your pulse, and then I'm also going to do your blood pressure. Okay, so first thing we're going to do is we're just going to take your temperature. I'm going to get you to take this stick here and just stick this under your tongue towards the back, like where your molars are. So your temperature is 37.3 degrees Celsius, and that would be in the expected range of 35.8 to 37.3 actually. So that's perfect. Okay, Grace, so the next thing we're going to do is we're just going to take your oxygen levels, and I'm going to put this on your pointer finger. And the red light is just going to take a measurement of the oxygen levels. So it looks like the concentration of oxygen in your blood is 98%, which is within the expected range of over 95%. Okay, so next thing I'm going to do is I'm just going to check your radial pulse. So I'm just going to put my two fingers here, and I'm going to count for 30 seconds on my watch and just see how many you have.
I'm going to take you to so this one does it. So on your time, what you're going to put your toe up and replace it.
And then what's your water bottle? Is this one? No? Was it in her sleeve? Okay.
Your favorite water bottle?
Temperature is 95.9.
I'd say you use the old fashioned.
What?
Are you comfortable?
Yeah, I will.
So that was 30 beats in 30 seconds, so that would mean you had 60 beats in about a minute. So that is within the expected range of 60 to 100 beats per minute. And then I'm just going to double check that one more time for 30 seconds again.
Take your temperature now. So your face is under your skin. Close your mouth first.
I'm supposed to tell him stuff.
So you're going to leave it?
I don't know if that's just like standing sitting. Take your hair. Sit down. We do a physical stand. Like that.
Okay, perfect. So I actually was doing there, I lied to you. I was doing your respiratory rate, so you had 10 inhalations and exhalations in 30 seconds. So if I times that by 2, it would be about 20 in a minute, which is within the expected range of 10 to 20 breaths per minute. Okay, next we're just going to take your blood pressure. So I just want you to have your arms straight ahead at heart's level, which is good. I might just put this in. And then make sure you keep your legs uncrossed. And I'm just gonna wrap this one around your arm.
I didn't do it all.
Good.
Yeah.
Okay, so I'm just gonna pump this up and I'm gonna listen, or I'm gonna feel your radial pulse until I don't feel it anymore. And then after that, I will pump it up to about 20 over that. So I stopped feeling that pulse about 120, so I will pump it up to about 140 or 150 this time, and I will listen to that brachial pulse or brachial artery.
Okay, so I'm going to check your radial pulse. So I'm going to time it for 30 seconds.
So for that reading, I got 120 over 68. So that would be within the expected range. Usually for hypotension, we would expect to see 95 over 60. And then for hypertension, we would expect to see 140 over 95. So you're within that good range there. Okay, so now that we're done with vitals, I'm going to start with the health assessment. So I'm just going to start with your face where you're already sitting up. So I can see that your skin is the color is even, with no breaks of integrity, and there's a pink undertone. And it is symmetrical at rest, and then keep smile for me. And it's symmetrical with movement as well. Okay, so next I'm just going to do your eyes, and I can see your eyebrows and your eyelashes have even just hair distribution, and there's no signs of alopecia, so like any hair loss there, and your eyelids are intact with no breaks in integrity. And I'm just going to check really quick with the light here. I'm going to check your ears, see if they're equal in round. And they are. And then, so they're equal and round there. And then I'm just going to come on one side with this light, and I'm just going to check with your eyes. I might go too far the other way. I'm going to do the same again. Perfect. Okay, so the pupils are equal, round, reactive to light. And then for a combination, I'm just going to show you this pen, and I'm just going to have you follow it inwards and kind of just cross your eyes a little bit if you can. Perfect. Okay, so it looks like the pupils are equal, round, reactive to light, and a combination. Okay, so I'm just gonna get you to turn your face a little bit this way. So I'm just assessing your ears, and the color looks to be the same as the rest of your face, and they have a pinkish undertone there. And you do have, it looks like just a little lesion, like a piercing there, but the skin around it is intact and healed. And there's no discharge. I don't see any discharge coming out. And the ears are in alignment with the corner of your eye, so where your ear attaches is actually in alignment there. And I'll just check the other side as well. So it does look the same on the other side. That piercing is healed, and it looks like the ears are in alignment bilaterally. So next I'm just going to do the whisper test for you, and I'm just going to cover your tragus just so it blocks a little bit of the sound waves, and then I'm going to whisper something behind your ears, and I'll just see if you can repeat it for me, okay? So I'm going to press there. 1, 2, 3. Okay, perfect. So and then I'm going to do it on the other side as well. I'm going to cover that tragus. Okay, so she was able to repeat everything that I said, or whisper it, I guess. So she is whisper test negative bilaterally. Just assessing your nose, so it does look like it's the same color as the rest of your face with that pinkish undertone. Your nose is symmetrical, and there are no breaks in integrity or any lesions or anything in that area. And then I'm going to check your lips as well and your mouth. So your lips look to be symmetrical, intact, and moisturized, and they're like a pinky red color. Can I just get you to smile for me? So your teeth are intact and your gums are held tightly to that. So you have all your teeth, they're white and they look clean. And then can I just get you to open your mouth and lift your tongue up for me? So your tongue does protrude at the midline. I'm just going to assess your neck. So it looks like it's erect and still in the midline, and your accessory muscles look to be symmetrical. And I don't see any pulsations of the carotid artery. Okay, so next I'm just going to test the strength of your neck there. So I'm going to test the muscle strength. So I'm just going to put my hand on the side of your face, and I'm going to have you turn your face the opposite way. So it's not too much pressure, just light. Turn your face, good. And the other side. Okay. So for rotation, the muscle strength is 5 out of 5 bilaterally, so full muscle strength. And then next I'm just going to do a shoulder shrug on you. So I'm just going to put my hands on your shoulders and I'll have you shrug up. Perfect. Okay. So the muscle strength there is also 5 out of 5 full muscle strength for your shoulder shrug. Okay, so I'm just going to get you to lay down on your back there, and I'll keep your head up for now. And then what I'm going to do is I'm just going to raise the bed just to a comfortable height. Okay. Oh. Okay, so now that Grace is laying down and the bed is at a comfortable height for me, I'm just going to inspect your thorax. So I can see that you have ease with breathing, your accessory muscle use is appropriate, and so are the retractions there. And so I'm going to assess the precordium. Just, I don't see any pulsations of the cardiac area there, so your heart isn't beating like too forcefully. Okay, so next I'm just going to inspect the anterior-posterior transverse ratio. So I can just see that it is about 2 to 1 there, which is the expected range for that ratio, so that's good. Okay, so next thing I'm going to do is I'm just going to assess your arms really quick so I can just see. So it looks like the skin color is even across, there's a thin hair distribution there, so that's all even. And there's like a pinkish undertone there. And the length and the size look symmetrical bilaterally, and the muscle development is even bilaterally. And then I'm just going to assess your hands. Same thing for your hands. And I'm just going to assess a capillary refill. So I'm just going to press on your nail for a few seconds and see if the color returns. And for your other hand as well. So the cap refill is 2 to 3 seconds. The color came back bilaterally, so that's all good. And then all I'm going to do here is I'm just going to feel the temperature of your arm. So, my glove. Yeah. So I'm just going to feel with the back of my hand. And the temperature is even across, and there's no changes there. It's not too hot, not too cold. And then I'm just going to palpate. So let me know if you feel any tenderness at any point. Did you feel any tenderness there? Okay, and I'm going to do the other arm as well. Just going to feel the temperature. Okay, so the temperature is even bilaterally across, and did you feel any tenderness on that arm either? Okay, so the patient didn't indicate any tenderness on either arm bilaterally. So next I'm just going to get you to do a grip strength test, so I'm just going to get you to literally just grip my hand as hard as you can. Perfect, and with the other hand. Okay. So you have a full and strong muscle strength on each hand bilaterally. Okay, so after I've asked Grace to just put her shirt up for me a little bit, so I can see her abdomen, and I put the head of the bed down, I'm just going to assess her abdomen so I can see the bed down there. So when I'm assessing the abdomen, I can see that the color is even across with a pinkish undertone. It looks flat with no masses or lumps or bumps that I can see right now, and there's no breaks in integrity there. So what I'm going to do next is I'm just going to listen to your bowel sounds in all 4 quadrants. So I'm going to start in the right lower quadrant. Okay, so after assessing the bowel sounds, they are active in all 4 quadrants and not hyperactive or hypoactive there. So next I'm just going to do a light palpation. So you will feel like I'm just going to depress like 1 to 2 centimeters there, so it shouldn't be anything painful.
Today we're going to be doing a head to toe stretch. Do you have any questions about that? Okay. Do you need to use tobacco before we begin?
So upon palpation, I didn't feel any lumps or bumps or masses there. And did you feel any tenderness when I was palpating? Okay, so the patient doesn't indicate any tenderness. Okay, so now that I put the head back up, I asked Grace to cover her abdomen, and I just put the bed back up to working height. I'm just going to assess the legs now. So looking at the legs, I can see that the color is even across with a pink undertone, even light hair distribution bilaterally, and the length and the size is symmetrical bilaterally as well. I'm just going to assess the back of your leg as well. Both.
Okay, and do I say all those things?
So I also don't see any varicosity of the legs, so that is good.
Sounds good.
And then I lightly palpate your legs, and I'm just going to feel for any changes in temperature at all, so with the back of my hand. Okay, so when I was feeling temperature bilaterally, I didn't feel any changes in temperature, and it's not too hot, not too cold, so it's just a regular temperature. And then I'm just going to palpate your legs, same with like I did with your arms. Okay, and for the legs, I'm also not feeling any masses, lumps, or bumps or anything, or any edema there. Okay, so next, just like I did with your hands, I'm going to assess the capillary refill of your toenails. So I'm just going to press on your toenails for a couple seconds. And the color did come back in 2 to 3 seconds there bilaterally, so the cap refill is, the color comes back in 2 to 3 seconds bilaterally. Okay, so next we're just gonna do a quick sensory test for you. So I'm just gonna use this probe here to touch your face, your arms, your hands, your legs, and your feet with light or sharp touches. And I'm just gonna get you to indicate for me if you feel a light or sharp touch. Okay. So you can indicate fully a light or sharp touch, so that's good on your face. Okay. So next I'm going to do the arms. So I'll just have you look away for me.
I recorded my instructions.
Okay, perfect. Okay, I'll do your other arms. Just away.
I do vitals and then record myself talking about how or should I?
Yeah, no, however you do it.
Okay, so the patient can indicate fully bilaterally on both arms if it was a light or sharp touch, and then I'm just going to do your hands really quickly. So just like this.
Is there
Sure.
Okay, and you wait, and like you're gonna work. I'll check.
Yeah.
And the other hand, just look away.
What we recommend is like what you recommend. So that takes 7 to 5.
Okay, so the patient can indicate on both hands the light and sharp touch bilaterally, and then we're going to do the legs next, and then we'll do the feet. Okay, so just tell me what you feel when I do this.
Is it okay?
Yeah.
And on this side.
a teddy bear? I have a teddy bear monkey named George.
Can we do it?
Okay, and then on your feet.
That'd be fun.
Light.
I'm very glad.
Light.
Yeah, but
Just light. 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 Okay, and then for the feet and the legs, the patient can indicate light and sharp touch fully bilaterally. Okay, so for the next neurological test, we're just gonna get you to put your thumb against all your fingers like this, just for me on both sides.
But you got it.
Okay, perfect. So the thumb to finger movements were smooth, coordinated, and intentional bilaterally.
You set the bar low, and then
Are you okay? Like, okay, so for the last neurological assessment, I'm just going to test your cerebellar function. So I'm just going to get you to put your heel to your alternate shin, and I'm just going to observe those movements, and you can move it up and down. Yes. And then for the next side. Perfect. Okay, so the heel to alternate shin movements are smooth, coordinated, and intentional bilaterally. Okay, so now that we're done with the head to toe assessment, I put the bed back down to like a height where I can be eye to eye level. Grace, and okay, so now that we're done with the head to toe assessment, I didn't find any abnormal findings or anything, so there's nothing to summarize there, but I was just wondering if you have any questions or any concerns, anything else you wanted to let me know before you go. Okay. So I just want to thank you for your time. I know that was a long assessment, but you did good. Now you can just remove the gown and put your clothes back on.